Here is a staggering figure for you. Over 5 million Americans are living with Alzheimer's. Over 400,000 of them are New Yorkers. The disease, which robs so many of their memories and creates a huge burden on their caretakers, is reaching pandemic proportions. Standing vigilant on a mission to eliminate the disease through research and support for all of those affected is the Alzheimer's Association. The organization has released a startling fact: only half of all seniors are actually assessed for thinking and memory issues. So the question then becomes, why? Well, here are some details and some thoughts on all of this. Dr. Ana Fidelia Tavares, who is the Director of Programs for the Alzheimer's Association New York City chapter. Doctor, it's nice to have you here with us.
Thank you so much for having us today.
So let me start then with some of the results of the study and some of the things that you're finding out there that may well be surprising. You start off with the notion that says Medicare, as part of your yearly health assessment, there is supposed to be some cognitive testing done. And yet, as I mentioned in the introduction, it's not done at all close to what you would expect it to be. Why is that?
Well, so what we found from the study was that there was a missed opportunity. On the one hand, we had patients who thought it was very important to be able to talk to their doctor. We also had doctors who found it was important, but patients were waiting for their doctor to bring it up, and physicians were waiting for the patients to bring up the memory concern. So clearly there's a missed opportunity. We want to bring awareness to this, make sure that seniors know that they should be talking to their doctor. If they don't know what symptoms to be looking for, we encourage them to call our 24/7 helpline, where they can get information, be connected to workshops on the 10 warning signs of Alzheimer's and how to talk to their doctor.
But let me come back to the one thing you said, and let's start with the seniors, then we'll talk about the doctors. They know that they should be getting some testing for it, but what are some of the reasons why they don't say, doctor, ask me some questions here?
So we found in our study that about a third of seniors reported fear of finding out. There were about 20% of seniors that we surveyed that didn't think that there were treatments available, so said, why bother? And so we want to make sure that people know that there are treatments available, that it's okay to be a little nervous to get a cognitive assessment, but it's a routine assessment that can happen at the doctor's visit. So it's still very important to bring this up with their doctor, because there are things that can be done and can manage people's anxiety, fears, as well as letting them know that there are treatments available if something was discovered.
But from the doctor's perspective, why are they not sort of on their own saying, okay, sit down, we have another part of this exam that we have to engage in?
Well, so doctors, we found in our study, are waiting for patients to bring up symptoms or concerns. Other doctors mentioned that lack of time was an issue in terms of their busy schedules. Also, doctors mentioned that they were unsure about what cognitive assessments. And so there are certainly areas where we can further support physicians, and that's something that we do at the Alzheimer's Association for primary care physicians. We have education, we have our cognitive assessment toolkit that is available on our website to educate physicians about what they can do in routine checkups to assess for memory or thinking concerns of their patients.
What is essentially the cognitive assessment that should be taking place in your doctor's office?
The reality is that these are brief assessments that can be conducted in primary care that can take 5 to 10 minutes. The cognitive assessments are different, but it can include observing the patient in terms of memory or thinking tasks, talking to family members, or a brief written test. But also people can bring this up in a routine checkup. And so that's really important that people know that they should be broaching this conversation. We also found in this study that doctors are incredibly receptive. More than 90% of doctors said that they would assess people if a family member or the patient themselves brought it up in a visit.
It's not that they don't want to do it.
Right.
They're waiting sort of to be asked in.
Exactly.
Let me talk now about some of the services and the things that are available for people. What can be done to help caregivers?
Well, so we have a host of free services available for caregivers. We have our 24/7 helpline, so a caregiver can call at any time of the day or night and talk to one of our social workers or counselors. They can get emotional support, but also they can get referrals to programs that are happening in their community. We have educational workshops, support groups, other things that are all free of charge that can support caregivers as they're experiencing these issues. We can also, sit down and strategize, because many times family members are seeing memory issues and they don't know how to bring up the conversation with the person that they care about.
And how about those who are suffering in the throes of this? You mentioned before then, I know a lot of them say, why should I bother? I can't get any help. This is not going to get any better. But there are things that still you can provide for them that can help them in their daily lives. Talk about that.
Well, first of all, it's important to recognize that these warning signs are warning signs that can be caused by many different diseases.
Right. Doesn't necessarily mean
that it's Alzheimer's. So it's really important for people to recognize that, and it's only a doctor who can make that clinical evaluation and diagnosis. And that's really important because the treatment will depend on what is actually causing the symptoms. So I think that's an important point. And so there are, in fact, many things that we can do from the clinical perspective in terms of treatment, but also ways that we can support people. And long-term care planning is very important, getting the family together and making sure that wishes and values are communicated to the family. So making sure that affairs are in order, like a healthcare proxy, are very important as we think about how to respond. So those are important things to do both on the clinical side, but as well as the personal and care planning side.
So where are we in terms of the research that's being done by the association and any progress in dealing with this insidious disease?
Well, so I think there's a lot of progress that we see. We are one of the largest conveners of scientists all across the United States, and every year we have a national conference, and there's a lot of promising data that's coming out. And so what we believe will probably be happening is that it won't be a silver bullet, but rather we'll have multiple ways of supporting people, diagnosing people early, as well as treating people with Alzheimer's disease. But there's a lot of promising research. One of the areas that is incredibly promising is in terms of blood pressure control. And we've seen some preliminary studies that tight blood pressure control can actually decrease the chances of mild cognitive impairment, which is something that happens before Alzheimer's disease. So that is incredibly promising that we will have something in the near future, in addition to the medications that we already have to treat Alzheimer's disease.
Well, it's good to know that progress is being made. We thank you and all the folks in your chapter and the Alzheimer's Association National for all the good work that you're doing for people out there, including their caregivers. Dr. Tavares, thanks so much for joining us. We'll talk with you again down the road as we continue this battle that we're involved in. And a reminder for you, for more information on the programs offered by the Alzheimer's Association, you can visit our website at metrofocus.org.